Hi, this is Dr. Zahalik, and I've got some more information for you about cancer. Got some facts and figures and some things that you can do to decrease your risk. So we'll start with the top 5 causes of cancer death in the U.S. So this is not the incidents, but the fatalities that come from cancer death. So same as it's been for many years, lung cancer is the number one most fatal kind. Number two is colon. Number three is breast cancer. Number four is cancer of the pancreas. And number five, cancer of the prostate. Slightly different list, but equally as important. The top 10 causes of cancer death in the US. Number one is skin cancer, and there's about 2 million cases a year of this. The vast majority of them are actually not the really bad kind. Melanoma is only about 5% of the overall causes of cancer, but it's still a big deal. What can you do about that? Well, the American Cancer Society says get your doctor to check your skin once a year and check your own skin once a month. We can provide you a list of what to look for, but it's the typical kind of things you'd expect. Um, if you see something changing, ulcerating, itching, growing, multiple colors, lopsided, looks different from one side to the other, squiggly, wavy border, those are the kind of things you should watch out for. And protect your skin from the sun by limiting your sun exposure during the really peak times and wearing sunscreen. Lung cancer, number two. The figures are kind of scary here. Men have an 8% lifetime prevalence of getting lung cancer. That means about 1 in 12, 1 in 13 men during a lifetime will get lung cancer. The figures are 6% for women, so that's more like about 1 in 16, 1 in 17. Obviously, it's skewed towards smoking, so if you smoke, your risk goes higher. Um, Here's an interesting figure, though. Of all people who get lung cancer, the 5-year survival rate is only 16%. Those are not good odds. However, if you get it when it's confined to the lung, it's a 53% 5-year survival. So obviously, early diagnosis is important. I will tell you that there is no universally accepted screening protocol for lung cancer. So here's some things to keep in mind. If you cough for a month, you should get a chest x-ray no matter what, even if you have allergies and you think that's the cause of your cough. If you cough up blood, you should have a chest x-ray. Um, and then your doctor will work with you to try and figure out what's the best way to do it. Some people get CAT scans of their lungs, and if you have higher risk, that's not a bad idea. But obviously, we can't do a CAT scan on everyone because there's radiation exposure, cost, and all that kind of stuff. So, but it's something that has to be dealt with. The number one thing you can do, though, is to, if you smoke, stop smoking, limit your secondhand exposure, and get with your doctor to work out an appropriate screening protocol. Number three is breast cancer. So things you can do to decrease your odds of breast cancer: get a mammogram when indicated. Typically, we start at age 40, sooner for people with a big time family history. And typically, we do it once a year. Until when, we don't really know, but usually you do it until late in life. The 3 screening modalities that we commonly use are breast self-exam, having your doctor check you once a year, and getting the mammogram on schedule. And yes, you should do breast self-exam. Even though the Canadians took that off their task force, it still is a good idea. Number 4 is prostate cancer, and that affects 1 in 6 men in their lifetime. And a lot of people say, well, is prostate cancer, that serious? I'm told that just something you learn to live with. The truth is, it's still the number 5 cause of death in the United States. And yes, more people who have prostate cancer will die of something else, but it's still worth following and checking up on. Colon cancer is the number 5 overall cancer in the US. It affects 1 in 19 people during their lifetime. What can you do about it? Well, if you have a change in your bowel habits, so you develop bloody stool or suddenly you develop constipation, you never had that before, talk to your doctor about it. And in general, we start at age 50 screening for that with a colonoscopy. If they're normal, every 5 to 10 years. If they show a precancerous polyp, you repeat that in 3 years and until they're normal, and then you go back to every 5 to 10. If you have a personal history of cancer of the colon, just get with your specialist. They'll tell you how often you should be screened for that. And also, if you have a strong family history of colon cancer, you should be screened a little bit earlier than 50. Again, get with your doctor on that. The sixth leading cause is kidney cancer. Seventh is bladder. So something as simple as having your urine checked with a urinalysis once a year, good idea. Obviously, if you develop voiding problems, frequency when you have to go, the urinary tract infections, they keep coming back and they don't respond that well to antibiotics. Sometimes that's bladder cancer. Number 8 is non-Hodgkin's lymphoma, which is a kind of blood cancer. You can detect that sometimes with a blood count, sometimes with abnormal lymph nodes, or the presence of what they call B symptoms, so fatigue, fever, weight loss, those kind of things, sweats. And then last is endometrial cancer, which is the cancer of the lining of the womb or the uterus. And that's often signaled by bleeding after the menopause. So if you don't have a period for a year and then suddenly you start bleeding, that's time to get that checked out. So what can you do right now? Let's say you have no risk factors, no family history, no symptoms. What could you do or should you do just to get checked anyway? Because we all want to limit our risk. Number 1 is still stop smoking. There is no good amount to smoke. You just stop. If you dip, you stop dipping. But stopping smoking is something you can do to limit your risk, and you really should. Number 2 is to eat a healthier diet, specifically less junk food, more vegetables. A good number is 5 servings a day. That's what the American Dietitian Association says. Less refined sugars, so less sugary drinks and that sort of thing. Less red meat, and lose weight if you're overweight. Number 3 is get a physical exam. The U.S. Preventive Health Task Force says that if you're 40, just do that once a year, and you can get lots of this screening incorporated into that. If you're between 20 and 39, maybe every 2 years or every 3 years. More often if you have more risk, maybe a little bit less often if you have less. Get a mammogram. Again, generally speaking, we start at age 40. Earlier if you have a family history, do them every year. Pap smears. Again, that's something you want to do on a regular basis to screen for cervix cancer. In addition to the pap smear for women who are over 35, we will add an HPV test, which signals increased risk. If you have HPV, you really have to do those pap smears every 6 months. But it's a good idea to start at age 18 or first sexual activity, whichever comes later for that one. Skin check, good idea. Again, once a year with the doctor, once a month on your own or with your help of your spouse. And you're looking for the abnormalities that you would kind of think of, the new mole after age 40, a changing mole, a mole that's becoming elevated, mole that's becoming ulcerated or is crusting or oozing, a mole that's been there for a long time and now that it's itching, irregular surface like a wavy, shaky border, lopsided mole, multiple colors. And you should be more suspicious if you have a family history of melanoma. We can give you a list of things that we look for at the physical on the skin, but it's something that you should get checked. And then the PSA and digital rectal exam are the 2 common ways that we screen for prostate cancer. Generally speaking, we start in men at age 50, but we start at age 40 if there's a family history or if you're African American, that's a higher risk. The American Cancer Society and the U.S. Preventive Health Task Force differ on what they think is acceptable. American Cancer Society says if you're screening for prostate cancer, you do a blood test, the PSA level, and a finger test, the test that makes all men uncomfortable and not want to come to the doctor. U.S. Preventive Health Task Force says either, they're both acceptable. You can get with your doctor and figure out what's an appropriate way to screen for you. But these are things you could do today to lessen your risk and to increase your screening, and it's something I strongly recommend. And please read the accompanying article. Talk to you soon. Take care.